So my name is Daniel Thompson. I am from Georgia. However, I've spent 12 years in Texas. But yeah, we drove here from Georgia. It took us 3 days to get to Brio, but it was a great road trip. So my condition and stage of my cancer when I got here at Brio was stage 4 cancer. It's head and neck cancer. I have 1 tumor in my mouth and 2 at the base of my skull. Yeah, so this one is kind of a long story. So the way that it was discovered that I had cancer is I actually had a root canal done, and upon checking the root canal, there was a small tumor up in my jaw, and within a week I had gone to a clinic. They'd done a biopsy. Biopsy was somewhat inconclusive. Within 2 months, I was already doing a surgery. Had 2 surgeries in 2017. It was at that time roughly stage 2. However, I had done a lot of the traditional medicines. And then in 2022, I had another surgery, a full craniotomy that cut me from ear to ear. And the intention was to go in and remove the what was believed to be osteoradionecrosis, so dead bone caused by the radiation. Well, once they'd gone in, they had realized it was a recurrence of my cancer. And so for my recurrence, it was discovered via surgery, and I had pumped the brakes on pursuing additional traditional medicines because it didn't seem to be as effective the first time. But it was really through surgery that it was found, and they were not able to remove all of the tumors. I had been reading, so for me to have discovered Brio was primarily through internet searches. I had been wanting to do non-traditional and homeopathic and naturopathic and integrative medicine for the last 2 years since I was re-diagnosed. And I had found some clinics here and there, but nothing to the extent that was offered here at Brio. And so after some conversations with James and a consult with Dr. Levant, oh man, within 3 days, I was here. And it has changed my life being here. So there was quite a few things actually, and to not bring up particular names of the others, the other clinics did not seem to offer all of the the infusions, the low-dose metronomic chemo, all the machines that are offered here. It really is a significant conglomerate of all these treatments and medications, and also the medical staff is so broad that each one has their own expertise, and I found that to be very welcoming, because they can each discuss with each other what the proper protocol will be. And so that definitely affected me in wanting to come here. So here at Brio, I've received numerous types of treatments. Even right now, my own IV, I've got high-dose vitamin C, I've got the methylene blue, and even finishing up, I believe it's the artesunate. And I had the fortunate outcome of some lab work that we did here to show that artesunate, which is, wormwood, has a 52% cell death on my type of cancer. So really wonderful to be able to have these types of treatments here. It's very difficult to find IV artesunate. You can do it orally, but it's not the same. I've also done the low-dose metronomic chemo, so it's about 10% of what you would get at other clinics, not traditional oncology. I've done hyperthermia here, which has been great, and that is something that, if you look into European oncology, it's very popular there, but here in the United States, it's not. And so here at Brio, they even offer things that you can't find so much in the United States. You would have to go overseas to get these sorts of treatments. So very fortunate to have that here at Brio. Yeah, oh man. The standard of care here at Brio is just phenomenal. Obviously the doctors themselves are great, but the nursing staff is amazing. There's such care and just true desire for the benefit and both health and spiritual of everyone, every patient here. Center of care is phenomenal. So my condition here at Brio has improved considerably. So obviously my speech is quite interesting. I do have an oral tumor. That oral tumor has shrunk visibly over the last 6 weeks. The 2 tumors that are in my head, I had an MRI done here recently. I'm waiting on the results. But when I started here, I had some temporal edema, and that temporal edema is no longer there. So it must have shrunk, even the 2 tumors that are in my skull. So it's been a huge blessing to be here and have the positive effects that I've received. Alright, so advice to other patients. Coming here to Brio, I would absolutely support, hands down. One thing that I would say is, in the event of being diagnosed with cancer, depending on your diagnosis, please understand that often it takes years for cancerous tumors to develop. So a couple weeks of taking a pause is not such a bad thing. When I came here at Brio, I was kind of under the gun. I'm in stage 4, a lot of things going on. But the moment I got here, I did those lab work, or those different labs. What I would encourage is, the moment that you have felt the leading to come here to Brio, go ahead and start that lab work early. That way the moment you get here, they are going to have all the different IVs, all the different type of standard of care for you, and that would allow you to have the best care while you're here. The doctors, nurses, and staff that's taken care of me the last 7 weeks, genuinely, I love y'all. The relationships that I've made, they've had a lifelong, lasting effect on me. Monday is my last day here, and they're making some tears. Yeah, oh man. I hope to come back physically in 6 weeks for aftercare. And if not, it'll be a Zoom, but nonetheless, I do look forward to coming back in the future. Yeah, it's it's a lot. The people here, their relationships are wonderful. Yeah.